Hello, thank you for watching my video on knee treatment with cold laser therapy. My name is Dr. Steve Alukonis. I'm a board certified chiropractic orthopedist, and I'm also a fellow of the American Board of Chiropractic Orthopedists, and I'm a member of the North American Association for Laser Therapy. Thank you for watching this video, and I'm hoping that you're going to gain a lot of good information and help. We see many patients that come in with chronic knee pain that goes unresolved. They seem to suffer day in and day out. Many of my patients have tried numerous other types of treatments, including surgery, that did not really get rid of their pain or their dysfunction well enough. And they are suffering all too often and really making their days miserable. So I came up with a great protocol that is being used not only here, but I consult with 500 other doctors around the United States, and many of them have implemented the same protocol, and it's been working great. So let's talk about some of the knee pain problems that people do come in with. Arthritis is a very common one, whether it's osteoarthritis or other types of knee degeneration in the joint itself, or the ligaments, or the meniscus, the cartilage. You know, if we had an injury at some point, over time that area starts to degenerate. And then that degeneration will cause pain, and it will create inflammation in that joint. So that's one of the main things that our treatment protocol works on. It's pain and inflammation. We want to get rid of the pain and inflammation long term if possible. Some of the other things would be tears, ligament tears, meniscus tears. You've all heard of torn ligaments and torn cartilage, things like that. Whether you went through the surgery or you basically let it heal without surgery, we have great success with that. Some people suffer from patella pain. That's pain around the kneecap or underneath or behind the kneecap. So that can actually create a lot of inflammation when you walk. We want to also help people that have stiff knees. They get up in the morning and they can barely move their knee. That's a common ailment that we help. So most of the patients that I have seen, as I said, have tried numerous other types of treatments, whether it's been over-the-counter medication or anti-inflammatories, steroid injections, other types of medicine injected into your knee, some with knee surgery, some with taking out pieces of the cartilage or cleaning up degeneration with surgery. Those are some of the things that people have already tried, and unfortunately many times it goes without enough success that you're able to get through the day pleasantly. Let's talk about what I do here in my office. The first thing I do is I want to evaluate your past history. I want to sit down and talk to you to find out how long it's been hurting you, the length of time you believe it started, how it started, whether it was from an injury, was it just from wear and tear, was it the type of work that you did. I want to talk about what types of treatments you had tried in the past, what you're trying now, any success in the treatments. So a detailed history is really important for me. I want to find out if you have other areas that are giving you trouble besides the knee, like your hip or your back or your foot. Now, the next step would be a thorough examination. I want to look and see if you have any past x-rays or MRIs, And then I start my evaluation by examining your knee. I want to give you the greatest thorough examination that you ever had. Because sometimes knee pain and knee dysfunction may not only be coming from the knee itself. So I want to look not only at the knee, but I want to look at the muscles surrounding the knee. I want to look at your legs. I want to see how you stand. I want to look and see your gait and how you walk. I want to look at the alignment of your spine and your pelvis. Some people have one leg shorter than the other. That can cause knee pain ongoing. I also want to see if you have good arches in your feet. Fallen arches can aggravate knee problems. Also, misaligned spine and pelvis can also put pressure on your knee. So there's a lot of things that we want to evaluate along the way. So a thorough evaluation is extremely important. And I may send you out for an x-ray, possibly in some cases. The next thing I want to do is set up another date for you to return for what we call report of findings. We call it an ROF. And I will ask for you to bring your spouse if you have one, or a significant other, because we go over a lot of important information regarding what to do and whether I can help you and what the cost of treatments are going to be. We may recommend certain exercises or stretches that are going to be important, and we like to have another set of ears with you so they can help you at home. So at the report of findings, I am going to give you my best recommendations. I am going to let you know whether laser therapy is going to be the best treatment for you, and I will go over other treatments that we may include with the laser treatment. Sometimes we will utilize other treatments along with the laser for best results. We, at that time, at the report, will go over the amount of treatments that may be required to reach maximum improvement. We will cover the length of time it'll take. You know, can I have you repaired in a month or 2 months? What will it take? And I will also cover your insurance questions at that time and determine what part of insurance may cover some of the care. We will evaluate all that by the time you come in for report of findings. So I want to thank you for watching my video. Again, I'm Dr. Steve Alukonis. Thank you.